Healthcare. It's not just about eating healthy or trying to exercise or anything simple like that. It's also about being able to access good, affordable healthcare at the doctor's offices. Currently, if you are not on insurance, you don't really have very many choices. Okay, if you notice at the doctor's offices, if you don't have insurance, you have to have $100 deposit to be able to put down towards your appointment, or they'll refuse to see you. So if you are poor and have no money and don't qualify currently for Medicare or Medicaid, you don't really have the option to pay the $100 because you don't have any money. So now these same people may end up with very severe pneumonia, or maybe even, who knows, serious cancer, depression, whatever else, and then it gets so bad to the point that they end up in the emergency room. Well, of course, in the case of an emergency, like they collapse from pneumonia or stage 4 cancer, that is going to cost tens of thousands of dollars, especially if they have to be hospitalized. Where if they had preventative medicine, where they could have gone in to see the doctor in the first place, just for a couple $100, maybe a few $100, they could have just, needed antibiotics and that's it. Or they could have had the tumor taken out, and in that case, that's only a couple $1,000 as opposed to several $1,000. So in that case, it saves money to have preventative medicine. And so, who do you think pays when these people have to utilize the emergency room? Well, if you notice on your bill, if you go to a hospital to see your doctor versus go to a clinic, you'll find that the hospital bill is much more expensive. Part of this extra expense is the fact that part of your bill has to accommodate the fact that the next person coming in might not have insurance. So part of what you're paying is already paying on the post end, the expensive end of healthcare. So by accepting funds for the Affordable Care Act for each state, we actually save money because we can now take it in and help them get the preventative medicine and save lives rather than waiting until stage 4 cancer and we're spending tens of thousands of dollars for a losing battle. So if your state hasn't already accepted the money, or let's say your governor is going to try to wait it out and have it go into default and wait until 2014, I urge you to please talk to your governor. Call her right now to have him or her accept the funds from the Affordable Care Act, because that'll actually save money in the long run. So sure, at first we might see a little bit of a bump and increase, but just like with any good endeavor, it takes money to save money or make money, and so we might have to spend first before we see the actual savings, but I can assure you, in the long run, we will see thousands of dollars saved because we're talking preventative maintenance rather than post-sickness treatment. And we all know that an ounce of prevention is worth a pound of cure. So, aside from being able to get the access, so make sure you call your governor, have them accept funds for the Affordable Care Act so you can see the doctors, and then on the home front, remember, make sure to eat healthy. So, eat your greens, okay? Eat your spinach.